We are now live, Paul.
Great, welcome everyone, and thank you for joining us for this webinar roundtable. My name is Paul Harvey. I'm the co-director of the Basic Research Programme with Rachel Sabatis-Wheeler, who is one of the participants but won't be presenting today, and I will in a minute introduce the distinguished panel. I'm just hesitating slightly because do you want me to get cracking, or are we waiting for people still to join? I'll keep going then. The format for today is I'm going to do a brief introduction of the panelists and a quick overview of basic research. We'll then have a panel discussion chaired by Carla Lacerda with the panelists, and we'll then move to a question and answer session where all participants can answer questions. We are being recorded. It will be shared online, so just bear that in mind. If people can put questions in the Q&A function and chat in the chat function, and you can also ask questions by raising a hand, and the chair will call on you. And when they call on you, they'll need to transfer you from being a participant to a panelist, which they'll do, and then you can speak. Just to run through introductions, Carla Lacerda is our chair. She's a consultant and humanitarian practitioner, most recently with UNICEF, supporting the Grand Bargain subgroup, which is now SPIAC-B, the subgroup on linking social protection and humanitarian cash, and has also worked with them on the UN Common Cash Statement. Our panelists are Lottie Douglas, a humanitarian advisor with FCDO in Nigeria, focused on linking humanitarian cash and social protection. Massimo La Rosa, who's been with ECHO in Amman in the regional office since 2018 and has 25 years of policy advice experience with EC, UN and NGOs focused on social protection, displacement and the humanitarian development nexus. And Weri Amamo, previously with IFAD and WFP, most recently as the country director in Ethiopia. He's now the CEO of New Growth International and adjunct professor at Virginia Tech. And I'm just going to start sharing my screen, so bear with me a second while I sort that out. And get rid of Carla's notes, sorry about that, Carla. And start the slideshow. So I'm just going to provide a brief overview of the Basic Research Programme. Basic Research is a research program led by the Institute of Development Studies, with myself and, as I said, Rachel Sabatis-Wheeler co-directing with Rachel Slater, who's part of the panel. And I haven't introduced you, Rachel. Rachel Slater, who's research director with Basic Research Program and at the Centre for International Development and Training at the University of Wolverhampton. Sorry, Rachel, I made careful notes of introducing everyone, but failed on you, because I knew who you were and didn't need to make notes. Sorry about that. So where was I? Basic, a four-year research program led by IDS with myself, Rachel Sabatis-Wheeler, Jeremy Lind and Rachel Slater as the sort of directors of it. It's FCDO funded and is, as the title on the screen suggests, about strengthening responses at the nexus of social protection, humanitarian aid and climate shocks in protracted crisis. There's been a growing focus on linking humanitarian action and social protection. That's part of a much longer debate about linking relief and development, about resilience, about the nexus of humanitarian action and development. That's certainly been going for a long time. IDS published its Linking Relief and Development Bulletin 28 years ago, I was just figuring out. But the recent debate around shock responsive social protection has perhaps been more focused on response to new shocks, on anticipatory financing, on natural disasters, and there's been a relative neglect of the challenges of sustaining support in protracted crisis, which is where most humanitarian action is focused on crises that have been going on into times for decades. So that's where the particular focus of basic research is, in an attempt to fill that research gap. So we're looking at how to strengthen the provision of social assistance. Sorry, lost track of where I am. As a response to the needs of poor populations living in places affected by protracted crisis. And the I'm going to skip that one. The overall basic research question and focus is this one, trying to generate a stronger understanding of the political economy and operational delivery of social assistance in settings of protracted crisis, and focusing on how social assistance can better serve the most vulnerable and poor in those crises. It's about finding the right combinations of actors, modalities, and instruments. The research agenda that we'll be tackling has 4 core themes focused around the politics and political economy, around climate change and livelihood resilience, around inclusion, participation, and accountability, and around systems for design and delivery, the research questions set out there. There are 4 focus countries: Lebanon, Niger, Northeast Nigeria, and Yemen. But additional research at a global level looking across the protracted crisis and different forms of crisis, with a particular body of work, as well as the 4 focus countries planned in Ethiopia, Pakistan, Syria, and Iraq. And I should say about where we are. So we've just completed an inception period, had our inception report signed off, and so are starting implementation of research. So we're just in the process of publishing a series of working papers around the core themes of basic research that were produced during the inception period and that summarize the sort of state of knowledge and evidence. One on targeting by Rachel and colleagues was published yesterday, and there are more coming out and more have been published over the last few weeks. So work on politics, accountability, on climate, value for money, and more. So do read and engage with those, but they are intended to sort of set up the research agenda for the the further empirical research that will be going on over the next 3 years, and that we're hoping to engage with communities of practice and people like yourselves as we start to design and implement that research. So do check out the IDS website, the LinkedIn page for basic research, and see what we've been doing. And so that's what's happened so far. Forthcoming, as I say, is research getting started. We're hoping to have some online e-discussions that can take forward the issues we're raising today with the social protection in crisis community of practice through sp.org, that should be happening in May, and we'll update you when we've got firm dates for those. And I've just put in coordinating with STAR. So STAR, STAAR, is the successor to SPACE, the social protection responses to COVID. And that is in its inception period and will be getting started soon. And that provides sort of shorter term technical assistance to FCDO and others around the same set of issues, and sits within the same FCDO basic umbrella and business plan. And so we'll be coordinating with STAR, but it's also good for you to be aware of STAR and the rich resources that have already been produced through SPACE, and the fact that that will be continuing. And so there's opportunities both to learn from our research and to learn from the technical assistance that will be coming out of STAR. I'll hand over to the panel in a minute. As I'm sure we'll hear across the globe, in Afghanistan, in Somalia, in Yemen, in Ukraine, in Sahel, and in other neglected and less high profile crises, there's alarming facts that our current models aren't working, and people aren't getting the assistance they need. They aren't coping. There's increasing risks of famine in Somalia, in Yemen, and just sort of needs not being met sufficiently. So it's clear that both better assistance is needed, and that good research and evidence to inform that assistance is needed. And I'll look forward to hearing from the panelists their views on how we can rise to that challenge and how basic research can contribute to it. Carla, over to you.
Thanks so much, Paul. Hello, and welcome again to everyone who's joining us in this roundtable discussion. I'm Carla Lacerda, and it is my distinct pleasure to facilitate the next two sessions just mentioned by Paul with our distinguished panelists. Just a quick reminder to some of you who may be joining in after Paul has covered the housekeeping rules. Over the next 30 minutes, I'll ask the panelists to answer roughly about 4 questions to get us started. And they're roughly questions that are keeping some of us, humanitarians and development practitioners and researchers, up at night. In the meanwhile, and as the panelists address the questions, the colleagues from IDS and I will monitor the Q&A box for your thoughts, reflections, and questions. We would be grateful if you can use the Q&A box rather than the chat box for those specific questions directed at the panelists. And we will aim to address all of your written and verbal questions on the second session of the Q&A for the remaining 30 minutes. So let's get to it. I would like to invite the panelists to perhaps all turn their videos on if they're able to, so that we can keep this as quite a lively discussion. I will get to the questions. So number one question, Paul gave us a little bit of the framework so far, but what is it from our distinguished panelists that we're seeing? What are we learning from current higher profile crises, such as Ukraine right now, Ethiopia, Yemen, about how social assistance can be effectively delivered? I would like to address this question to Were and to Rachel as well, perhaps. Over to you.
Thanks, Carla, and good afternoon or good morning, wherever you may be, or good evening even. It's really a pleasure to be on the panel. I think, ultimately, there's really one overriding aim in these contexts, I think, and that is, predictable cross-line operations in these conflict situations. And I think we've learned that it's very complicated and difficult to bound this challenge coherently. There's lots of gray area where it's clear that standard rules of operation don't really apply. So I think we need to do less of some things and more of others. This is what I think we're learning. The first thing to do less of is, less Twitter-driven, Twitter-based good guy, bad guy language that suggests a taking of sides, even if this is only implicitly. That's so damaging. Less doctrinaire adherence to abstract humanitarian principles. Again, oftentimes this is just not helpful, but really more awareness and recognition, and I would even say an embrace of these gray areas that are really tough ethically, operationally, politically, at a personal level. You really got to face these gray areas that are so profound and so pervasive in these contexts. And really, another thing to do more of is more readiness to be pragmatic in the face of all of this gray areas, all of these gray areas. So we were told to keep it short. I will stop there. Thanks.
Thank you, Were. Rach, feel free.
Thanks, and thanks also so much for the invitation to join the panel. I'm going to focus a little bit more on the countries that you raised in the question, so Ukraine, Yemen, Ethiopia, and talk a little bit to what we're learning from those situations at the moment. I guess starting with Ukraine, I imagine most people on this call are often focused on countries with very low capacity, very low coverage of social protection. And so in Ukraine, we get to learn from and figure out what's possible in a country with substantial capacity. So a country that spends nearly 25% of its government budget on social protection and linked programs. And there we're able to learn about how governments themselves can keep existing systems, existing programs, existing payments going. And what we've seen in Ukraine have been a number of actions by the government itself, not just by external agencies. In particular, things like shifts to ensure that access of existing beneficiaries, such as displaced people, to their entitlements to social protection. So Previously, we had many recipients collecting transfers in person from specified banks and post offices in specified locations. So lots of challenges within a week, lots of changes within a week or so of the Russian invasion, a mechanism for changing your address for those displaced, a My Transfer system, so a bank-based Western Union system where people can collect payments from banks without needing a bank account, the provision of additional humanitarian support. And it's a reminder to us to start with the existing system. I think in Yemen, the key thing is that there are lots of international agencies working with and through the existing National Social Fund for Development. So they're great examples for how humanitarian responses might work through government, quasi-governmental, parastatal agencies. So you've got agencies like UNICEF and the World Bank working through the National Social Fund with the Emergency Cash Transfer Project. But that raises a lot of questions for us. So how do we deal with targeting overlaps and exclusion? What do we do about eroding transfer values? What do we do about whether or not capacities are being strengthened? And they're all areas where we aren't learning enough. We need to learn more and get better evidence. And then finally, in Ethiopia, limited knowledge there of what's happening to the main social protection program, the Productive Safety Net program, PSNP. Who's still receiving PSNP? Where are they receiving it? When? How often? And the thing that we might really need to learn from Ethiopia is, what are the features of delivery in Ethiopia that enable it to keep going during a situation like this, particularly in Tigray? And what are the things that prevent us from still delivering those programs? So a lot of learning from those three countries at the moment. Over.
Thanks, Rach. And I think in addressing that, we will be touching on those points as well a little bit later in another question, but really ensuring that humanitarian action is also coming in and looking perhaps at existing systems first in the very first wave of response, or as early in the early onset as possible in emergencies. So thank you for that. And where your point on good guy, bad guy, I think it's relevant for perhaps all three countries that we mentioned. And what are we learning? This is a second part to the first question. What is it that we're learning from the crises that risk sliding down the agenda a little bit more? So we're talking about Northeast Nigeria, Iraq, Syria. Perhaps Lottie and Massimo, would you like to address those questions? Over to you.
I'm happy to come in there. Thanks, Carla, and thanks to everyone for having me join today. It's really great to be here. I think as we look at kind of all of the global learning, and really kind of in Northeast Nigeria grapple with the fact that actually the application of some of this global learning is proving to be difficult among a lot of actors that are trying and committed to supporting local systems and to providing increased access to ongoing support for those most critically in need. I think it's important that we recognize that that it has proven difficult, and I think the learning there is really that the context is really key. And I think something like BASIC, drilling down into specific country context to really delve deep into what's going on and where is so important in order to build an evidence base that different actors with different approaches and different kind of thought processes can come around and look at together, and then think up appropriate next steps. So, just to go into a couple of examples, and Carla, you might have to stop me if I go too long, but so for framing in Northeast Nigeria, there are these compounding shocks and vulnerabilities that make the operating context really complicated, exacerbate vulnerabilities and risks, and stretch both government and humanitarian resources and challenges access to affected populations. This includes ongoing conflict, climate shocks, repeated displacement, severe food insecurity, malnutrition, protection risks, alongside high rates of inflation, weak infrastructure, in some areas. And there's also a large proportion of the population that the humanitarian community does not have access to. this is important framing because it helps us acknowledge the rationale for both what's different in terms of ways of working, as well as what's similar. And I think really starts to kind of provide opportunities to harness both the differences as well as the similarities. For instance, coverage. The humanitarian community focuses on the Northeast, where the coverage of the federal nationwide social safety net programs is still relatively low. On the one hand, this reduces friction or overlap between the two systems and potentially provides space for prudent and thoughtful horizontal expansion. However, I think it's also really important that we interrogate why coverage is low. Is it we assume resourcing? Or is it in fact that the system is difficult to apply to much of the humanitarian caseload that is served with humanitarian assistance? In Nigeria, it is difficult for people in displacement to go through the same registration and targeting process as people that are not in displacement. So how can we, as a humanitarian community with experience with people in displacement, look at potentially helping to correct that kind of more systems level issue before we start talking about extending a system that can't actually be easily applied to all of the caseload that we're serving. Then I think the other thing is that provides opportunities as well. The modality and the outcomes are overlapping but different. The humanitarian basic needs assistance in the Northeast is designed to meet basic food needs. And there is an increasing use of cash-based modalities, including cash transfers. However, the majority is still restricted vouchers and in-kind assistance due to the limited reach of financial service providers in some areas where humanitarians work. And other reasons. I'm just going to focus on that one right now. Meanwhile, the federal social assistance program delivers unconditional cash transfers to the poor and shock affected nationwide. The intended outcome there is to support consumption and prevent further backslide into poverty, and evidence shows that most expenditure is actually used to meet food needs. There is recognition of the efficacy of cash transfers as a tool to more effectively meet critical basic food needs among humanitarian actors, provide more choice, more inclusively support fragile markets, and support increased access to government social assistance by supporting payment providers to extend their services. However, I think that's what we're learning in that respect, is that how does a humanitarian actor change the ways of working? How do we come together as a community to work with payment providers to help them make the business case and help them tweak their services to be more relevant and to extend their services into the areas that we operate? In order to enhance the efficacy of humanitarian aid by enabling a shift to cash transfers where feasible and where appropriate, but also enabling the government to distribute cash transfers in the form of payments in areas where those services are currently still quite tricky. I'll pause there and hand back over to you, Carla. Sorry.
Thank you so much, Lottie. No, and I think your point is valid. I mean, it's about not having a blueprint, about looking at the context, and about really looking at the complementarities and where humanitarian action can really step in and be most useful to support social assistance. Massimo, would you like to add to that and contribute? I'm sure you have a lot to say on that. Thank you.
Yes, thank you, Carla, and good morning and good afternoon, everybody. Very quickly from my side, the short answer is, are we learning from the current crisis? I would say yes, we are learning a lot. Maybe just a quick overview on a couple of general issues and then a couple specific on the countries. What we are learning is that to respond to the humanitarian crisis more and more often in the landscape of the key stakeholders, we do not have anymore only the humanitarian stakeholders or humanitarian donor. From the very beginning of the early stages, we are working and try as much as possible to have a joint or complementary analysis with development donors and international financial institutions. If we look at some of the big crises that you mentioned, often some of the biggest donors are not humanitarian. Probably the only one where we have a clear share more on the humanitarian side is Syria. But then we will see it's more for political reason. On the others, humanitarian are contributing to a large investment already ongoing to respond to crisis from the development and the international financial institution with grant and loans or blended. So this is, I would say, is a key important message. And we know that the large expansion of humanitarian cash was probably a driver for change, not only for the efficiency of the humanitarian response, but also as a transformative element in the way how we are working in these days. Just two quick points. One, maybe on Ukraine, because I think it's very important also to add a legal aspect of what we are doing. For the response outside Ukraine, I think probably what we are seeing in these days, but it's too early to know exactly, but I would probably call an historical change in the legal framework. The temporary protection card that is enabling as a portable entitlements within the EU 27, potentially to access also social protection, health, education, and social assistance could be a significant change for the future. And it's not only for Ukrainians, it's for all the nationalities, for those that were resident in Ukraine before the war started. The other point is on Iraq, and that is more on financing. It's happening already, the transition between the humanitarian to social protection and longer-term development. The big issue here is financing. How could social assistance expand in a way that is financially sustainable? And I think the big question is another time probably not only to consider social assistance as an objective, but just as a step in a pattern to self-reliance. And in this case, we needed to consider how the other investment could help people in a certain point to exit from social assistance and to receive additional support. And finally, the very last is about the political agenda, as I said, on Syria, where these kind of linkages between humanitarian development is much more difficult. And this is also due to the political analysis that is not conducive today to have large investment on development in these days. Over to you.
Thank you so much, Massimo. Really poignant points. And I mean, in terms of what are we learning? Yes, we're learning a lot. If we can see the historical changes that you mentioned in the Ukraine, and it's not just temporary protection to receive social assistance, it's also to allow people to work as well. So beyond relying on social assistance, allowing them to also be agents of themselves, which we didn't see in Greece, for example, when refugees were coming in. Also, we're seeing in Italy, for example, providing social protection assistance at the moment to Ukrainian refugees. And I think these are all great points. And the linkages, obviously, between humanitarian and development donors, which is so key to make sure that whatever humanitarian action is being done to support social assistance can then continue in terms of strengthening those systems better. Thank you so much. I'll head to the second question. Where do we have big knowledge gaps on social and humanitarian assistance provision in settings of protracted crises? And which things are we struggling to get right? What is stopping us from doing things better and learning how to do things better? This is to all of you. And I think, Where you touched upon this in the beginning of your conversation as well, about how do we do things differently? How do we do things better? Over to all of you. Anyone who'd like to come in.
Okay, I'll jump in. I guess a couple of puzzles that I can speak to. Hardly any food got into Tigray from around June of 2021 until December when I left WFP. And it was a real puzzle. How did these communities cope? What resources did they really have at their disposal? So there's something about assessing and understanding vulnerability that we need to understand a bit better, so that we reach the right conclusions, because I think there were lots of wrong conclusions being drawn. Another puzzle, again, from that part of Ethiopia, the price of cooking oil in Mekelle around August, September of last year was roughly the same as it was in Addis. It was a big surprise to us. And, so clearly markets were working, but, how were they working? Who was getting stuff in and how? So really, some better sense of markets would be important. What are we struggling to get right? I think some balanced communication about problems, solutions, the road ahead. I think it's a big failure there, in my opinion. We keep getting it wrong, in my view. And what is stopping us from getting that balanced kind of communication? I think there's a bit of a clash of perspectives. On one side, the domestic policies, motivations from the domestic politics of donors and donor countries on one side, and then on the other side, the sort of on-the-ground realities. And I think also a poor understanding or lack of willingness to invest in understanding local politics. So it's sort of back to the good guy, bad guy mentality, the good guy, bad guy approach, which really militates against the kind of balanced communication from these contexts that needs to happen, so that the ground is freer for those agencies, those actors trying to do something on the ground. Again, we're told to be brief. I'll stop there.
Thanks so much, Warai. Would anyone else like to come in?
Carla, I can come in and just pick up on the communication point there, I think, which I absolutely agree with. I also agree with Warai's point on a deeper understanding of vulnerability and clarity on we define vulnerability as well. But picking up on the point of communication, I think that's really important. I think that often these there's a rush to kind of predetermine what the linkage will look like in a country, and that typically focuses on relevant and relevant but quite blunt instruments. And I think that typically that tends to be around using the same payment provider, which can be hard in contexts where kind of crowding around the same payment provider puts extra pressure on liquidity, et cetera, et cetera. There's often kind of conversations around humanitarians populating data registries, but that's hard until they understand who could actually be eligible for anything and what's on offer in order to communicate to that household that is in crisis why that information would be shared, and to really think through the the risks and the opportunities for that. And then I had one more, didn't I? Payment provider, registry. What was the other one? Anyway, the adoption of the same transfer value. Sorry, adoption of the same transfer value. And again, that's quite a blunt instrument to begin a conversation with. And I think what that does is often result in a quite binary we're in or we're out, before anyone really has the time and the space to understand who you're serving, where, to what end, with what, and to address some misperceptions, and to build some trust, build some understanding. And I think with doing that, what you end up doing is building a lot more space for nuance and a lot more space for more innovative and context-specific linkages that could be really, really meaningful, just might not be the most obvious ones. I think also with that in mind, I think it's really important that we recognize, and maybe this goes to some degree to explain why we do tend to often rush to the use of blunt instruments, is that the number of people that tend to traverse the humanitarian community, as well as the development, social protection, government stakeholders community, that is quite few and far between. And I think if we really want to commit to identifying these quite complex linkages in quite complex environments, then we have to carve out space within and resources to really kind of support that to happen. I think another thing to highlight is and a way to kind of, I guess, address some of these problems is that we need to continually, I think in the humanitarian space, we often see the linkage as some kind of end in and of itself. And I think it's really important that we continually stay true to and ask to what end, what is the linkage designed to do, and how is it supporting systems or households? And I think also we need to think carefully about building cohesion in the types of systems that we use in the humanitarian space, because without that cohesion in the ways that we operate as humanitarian cash actors, I think it will be very difficult to scale a linkage, and I think that will inhibit the kind of the change that we eventually see in reality. Over to you.
Thank you, Lottie. Really poignant points, and I think really helpful also for the humanitarian actors on the ground. I'll pass over to Massimo.
Thank you, Carla, and I'm very quick on this point. I would say, let's call impact evaluation. Is it something that are we doing systematically in the learning in these days? Probably not always when we enter in the linkages between the humanitarian and social assistance. I think we are still learning in the way how the analysis from the humanitarian, the need assessment and the system assessment, often from social protection, could be the basis of this dialogue, but too often we don't have yet strong evidence on the impact of what we are promoting in the last few years. So I think this is an area where I think we are doing, but we can do much more in the future. And linked to this one, as I said earlier before, I think if we agree that the linkages between humanitarian assistance to social assistance is a step towards self-reliance. And if we consider that this is a step to self-reliance and is not the end goal, we need to understand at a certain point, especially in protracted crisis, which other tools and instruments we have, probably better placed than social assistance for certain categories of stakeholders. Not all the most vulnerable will stay forever in social assistance. Others at a certain point could be recipient of different kind of programs. I think we don't have enough evidence in comparative terms, in terms of costing of financing during the pattern of self-reliance, and a certain point during the crisis when other instrument could be better placed than social assistance. Over.
Thanks very much. I have so many thoughts to comment on that, but Rachel, please come in.
Thanks. I guess in the basic research inception phase, we spent 12 months trying to identify what we thought were the main knowledge gaps, and there are many of them. But I'm just going to pick up on two. The first is really about power and politics. So there's lots of work done on how power and politics drive government social protection. For example, all the work at Manchester University by the ESID project. But I think we'd argue that there's far less of this thinking that's focused on situations of protracted crisis in that space where development and humanitarian actions intersect. And it means that at all levels, not just national level, at provincial, district and community level, we struggle to understand what drives decisions about social protection and how they are made. And the points that Wary's made about the good guy, bad guy scenario resonate. We oversimplify governments as being one or the other. There's really little nuance in our understanding of who does what and why. And I think that's part of what's stopping us doing things better. There's also a fair amount of noise about social contracts, social cohesion, state legitimacy, and their importance, but not actually very much understanding about what drives these processes and if and how social assistance can contribute, and what influence humanitarian action then has on those. So that's one big knowledge gap for us. The second one is We think there's still, despite us making noise about this as well, there's still little understanding of how various factors compound and combine with one another, particularly the combination of conflict and climate shocks and stresses, and what the implications are then for social assistance and what we can do about it. And even though many of the countries that we're working in face both kinds of shocks, much of the knowledge about that we have at the moment, so adaptive social protection, shock responsive social protection, remains tilted towards climate related shocks, and we've got far less on conflict. So we think that's a big knowledge gap. We also think we maybe need to think about some of these compounding shock situations differently. So part of the problem is that we don't differentiate very well between the problem that we are trying to tackle using social assistance and the context in which we're working. So I think we get stuck because we muddle up whether conflict or climate are things that we're directly using social assistance to respond to, or conflict or climate are something that we're not directly responding to with our programming, but it's just part of the wider context in which we're working. Now, we got better at designing programs with a particular context in mind because of COVID. So if you think of things like adaptations to existing programs made during COVID to reduce infection risk, having people wash their hands at collection points or points where they registered, or temporarily stopping using biometrics for identification was not a direct social assistance response. It was how we dealt with the wider context in which we were working. And I think if we don't make that differentiation between being sensitive to the context and directly responding to something, we start to run into trouble. So we're going to try and do some of that with BASIC as well. Over.
Thanks so much, Rach. And I see that there, while everyone was talking, there were some hands up as well from the attendees. We'll get to that in a minute. We do have 10 minutes left for this session, and we do have 2 questions left. So I'll go straight into it if that's all right. The next question is, what are some of the friction points for international aid agencies and governments in terms of learning and provision of assistance in crises? I think that, Rachel, you touched upon it a lot. Lottie, you did as well. I think what we're talking about is really the lack also of nuance and the lack of sort of relationship building with governments before even we respond to crisis. And it's not just solved by ticking in the box that we've done anticipatory action. It is really about understanding how governments work and how each government works quite differently. How do they do social protection? How do they do social assistance? How do they protect the people in their countries? And then obviously there is the refugee question and the migrant question as well that then gets compounded by it. But I would like to maybe open this question to Massimo, to Were, if you'd like to come in for that. On the friction points for international aid. I do have some points on that as well, but I'd like to keep the conversation moving so we can get to the really exciting Q&A session in about 10 minutes. Thank you.
Thank you, Karen. 1 minute only from my side on this question to save time for the Q&A later on. I would say two quick points. One, if we look at the humanitarian development and peace nexus, I would divide the question in the P, that is the vision, and Rachel mentioned before the social contract, the way how host government and international community could agree on a longer-term agreement. Often short-term solutions are not able to fix problems. And that's why I think even when the humanitarian are involved, we need to look at often on the protracted crisis with a long-term vision. I think this is key to have commitment from all the parties. And the second point is on the H&D together. It is much more technical. Often we have friction on targeting and value. And this is quite common when the humanitarians are coming with the life-saving approach and would like to pay 100% of the minimum expenditure basket. And the colleagues of the longer term say this is not financially sustainable on the long term. And that is the time in which we need to make compromises. So in the targeting in terms of quantity and the quality of the people that we would like to serve and the value of the transfer. Over to you.
Thanks, Massimo. Where did you want to come in?
Yeah, sure. Actually, some of them are the points I would say resonate with what Massimo said. I think it's the same old friction points. I would say, assessment of needs, targeting, access for delivery, access for monitoring, accountability. These are all friction points that are long-standing. But I think the thing is now in these settings that are increasingly gray and very, very fraught with all manner of information coming from all manner of places. I think there's a new brand of friction which is appearing in these standard these old friction points. So to me that would be the answer. Just a layer of complexity and a layer of friction generation in these old areas.
Thanks so much, Wary. And I do think that I would just add also that perhaps even beyond talking about understanding the context better, coordinating, and there is that friction, right, of the emergency response being very immediate, being on the ground, wanting to be seen or wanting to deliver very quickly the assistance. There is that friction also, which is coming from humanitarian agents, but also from donor pressure to deliver. I think that would be one point that I would add as well. And also a point about not just coordinating, but also collaborating and increasingly making sure that we don't have all these agencies perhaps coming into the government and saying, we'd like to help, we'd like to understand the context, how can we complement, how can we do this, and actually also trying to collaborate with those that have been on the ground before and working together to not compete, to work with the government as well on those matters. So we have about 4 minutes left, and one last question to Lottie, Massimo, Wary. If you could choose one evidence gap and one exciting thing happening in the sector that you think basic research should look at, what would they be?
I'll come in first because you said my name first. I hope that's okay, guys. Okay, so the evidence gap that I am most excited about for basic actually responds to some issues raised by Massimo and Were, is around targeting, is around based on some work that we started in Iraq and was, as Massimo mentioned earlier, was kind of unable to move to fruition because of issues around financing of the social assistance government system in Iraq. However, it did outline a potential pathway that I think is really exciting. And what we did there was leverage the fact that the humanitarian community based their targeting on a proxy means test approach to generating eligibility criteria. At the same time, the government also had their own proxy means test. What I'm talking about in terms of alignment of methodology here, it's really important to note that the criteria were different. The criteria that these separate proxy means tests developed and kind of resulted in were different. However, there were similarities. And what this led to in terms of the research was a situation where there could be kind of a household assessment that could be administered to humanitarian caseload that would indicate eligibility for humanitarian assistance, and then recognizing that humanitarian assistance tends to be far more inclusive in areas where humanitarians work than often social assistance. If you administered that household assessment, it would also be able to indicate likely eligibility for government social assistance. And then with that, you would be able to distill who from within your humanitarian caseload would potentially be likely eligible for government assistance, to then focus in on communication about what will happen if they wish to be referred to the government, where their data will go, what the next steps would be, careful communication with crisis affected populations. And it would potentially also enable prioritization of the government enumerators in terms of where they prioritize onboarding to their to the social assistance system. That's something that kind of the pathway was looked at in Iraq. It's now being built upon in Nigeria. And I think that's something I am really excited about. And I think it is typically a kind of a thorny, but a gap in the learning that exists. So contributions there are quite important. In terms of what I'm excited about in the sector, actually, maybe I've talked for too long, so I'll just pass back to Carla.
No, we'd like to hear what people are excited about. Please feel free to finish that sentence.
Okay, well, one thing I am excited about the sector, and it might sound a bit mundane, but I am excited to see genuine efforts among the humanitarian cash community to enable much more predictable, timely coordination. And you see that with the Cash Caucus result of the Leadership for Humanitarian Cash. And you also see that in a lot of efforts by the Donor Cash Forum in terms of how can donors come together to agree upon a common vision and harmonize standards among themselves, so that then they can actually kind of harmonize or coordinate the way that they fund basic needs cash assistance, and therefore enable much more coordination and consistency across various implementing partners. I think that's exciting. I also shamelessly just want to say that I think that the work produced by the World Bank recently around harnessing social safety nets to reduce or prevent the impact of gender-based violence and empower women is also really exciting, and I really highly recommend that folks look at that toolkit. Thanks.
Thanks so much, Lottie. Would anyone else like to contribute before I wrap up?
Sure. I'm not sure if these are exciting topics, but I know there are two topics that I would be interested to know more about. And the first is to what extent and through which mechanisms of power and influence, and with what impacts do the domestic politics of donor countries drive the strategies and operations of humanitarian agencies in these very increasingly complex humanitarian crises. And then second, what are the impacts of racial discrimination and racism in the humanitarian sector, and how that defines leadership or lack thereof at all levels. I think racism is pervasive in the sector and really needs to be better understood. And then the first one about this power of donors on these organizations. I think these are sort of big elephants in the room from my perspective. And really, if BASIC were able to make some headway on them, it would be very helpful.
Thanks, Wary. Massimo, Rach?
Carla, maybe just two points. One, evidence gap. I would say social insurance. We discuss a lot about social assistance, and I think we created a lot of synergies between humanitarian assistance to social assistance. Why not to have more evidence in linking social insurance in particular cases? This is the gap. And in terms of exciting things that are happening, I would definitely say shock responsive social protection. This is something that in which we are all working a lot, and I think we should try to see how good could be as an additional area to respond to all kinds of shocks, and potentially to add this element even to current social protection systems that were not designed to have shock responsiveness included. Over.
Thank you, Massimo. Rachel, would you like to add anything? You're good.
I'm good at the moment. Why don't we let the discussion move on? Thanks, Carla.
Thank you. And I would also just take the opportunity, I would add perhaps just a couple of things where I think some evidence could be helpful as well, is just where can we see more of humanitarian actors looking at social protection from the first wave of response. I think, as Wary mentioned, we are not doing things as well and as we would like to, and we keep making mistakes all the time. In Ukraine, for example, we are coming in and we are delivering to 1.4 million people, about $288 million worth of cash assistance. And we, the Ministry of Social Protection, etc., have not come in from the get-go, from the very beginning. We have not been looking at those things. I know the Cash Working Group is doing great efforts around that, obviously, and discussions are ongoing. But why is it that there is this dichotomy between the speed to deliver humanitarian assistance without looking at social protection from the very first wave, which could really help improve both the comprehensiveness, the effectiveness of the response, but also the speed, I would say. My second question would also be a little bit perhaps evidence gap. I don't know if legitimacy, looking at legitimacy of humanitarian agencies, when do they come in? Are they being invited by governments to come in? We look at these big emergencies that are coming in, and who let them, come in? What is allowed? Is it donor funding? Is it the governments, the host governments, etc.? So I think the question of legitimacy and when is it that there's too many humanitarian agencies coming in, and to which extent we need to not only collaborate but coordinate. So I will wrap up the session, and I did take a couple of minutes for myself. I'm sorry for that, but just to add to the discussion a little bit. Thank you so much to the panelists for their insights on those issues. And we would like now to open the floor for questions, thoughts, and reflections from all of you. I know that some of you have been putting questions on the Q&A and on the chat, but if you would like to speak, please put your hand up and I will call your name and our IDS colleagues will unmute you. In the meantime, I will look for some of the key questions that are coming through the chat, but please feel free to put your hand up. We would be grateful if you could introduce yourself, and if you have a preference, please feel free to propose who you would like to address your question to. And we have a request from our panelists that we would like to ask participants to state explicitly why filling that knowledge gap is important, and what could happen if we had that information that can't happen now, and what information is really, really useful at the moment. Thank you for considering that, and the floor is open to you. I don't see any hands up, so I will start. Oh, Martin Greeley, please come in, thank you.
Well, thanks. And a very fundamental question, then looking at humanitarian response, and you've referred to the issues of their approach as one of urgency and perhaps not taking sufficient time to engage with social protection systems. But the humanitarian response to that, and I've posed that question, is why don't you engage more with social protection systems, is that we're here to save lives, not build states. A humanitarian actor who takes that point of view might identify a knowledge gap, asking, what are the costs in terms of human life of taking the time and resources away from immediate response to state building activity of social protection systems?
Thank you very much for that question, Martin. Who do you work for, did you mention? Sorry.
I'm at IDS.
IDS, fantastic. Thank you so much. Would any of the panelists like to address this question while I dig through the Q&A and see other participants with their hands up? Thank you. Rachel.
I can have a go at that if you like. I think the first thing to say is that I don't think they're necessarily either or scenarios. I think the situation that we've just seen in Ukraine has shown us that working through the social protection system, it was possible to get support out there much, much faster than international agencies were able to get in and start doing support. So within days, the government, the Ministry of Social Policy, had established a humanitarian bank account and fund to start immediately supporting new people who weren't already covered within the social protection system. It had already started topping up benefits. And as a result, agencies like UNICEF have already started routing through government because they've recognized for some, if not all of their programming, that is the fastest way to act and it is the fastest way to save lives. So I don't think it's an either or. And I also think that the idea that you shouldn't be state building or that you shouldn't be building elements of the state associated with social protection. I think that's not necessarily what humanitarian actors are doing when they work with and through a social protection agency. I think one of the things that humanitarian agencies are getting better at doing is making sure that whatever they do with or through government leaves something behind in the long term. So it becomes a really positive byproduct of the way in which they engage with national systems, rather than something that is directing resources away from the primary goal of saving lives. That would be my perspective on it. Over.
Thanks, Rachel. Lottie?
I mean, I think Rachel covered really most of the points I was going to make. I don't think the two are mutually exclusive. In my experience, yes, of course, preserving life, alleviating suffering is a key aspect, the key goal of humanitarian aid. However, there are many different agreements that we have that really do highlight the very important need to support local systems, etc., and commitments to humanitarian development peace nexus. And there are a lot of ways in which those commitments, I think, are, in my opinion, more broadly accepted by humanitarian actors than they were maybe, a decade ago. So hopefully I'm not mistaken there, but I do think that time spent together is really important. And I think given the way that humanitarian architecture is structured, and the imperative to respond, often there is just simply not the capacity or the resources to open up a whole new kind of can of worms and actors to coordinate with. And I don't think that's a good answer. I just think that's a reality. But I think it's really important that we recognize that, so that we can better resource the humanitarian actors and help them find the kind of the time, space, resources, expertise to engage in a really important conversation. Thanks for the question, Martin.
Thank you. No, and I would also add that perhaps I think it's what Rachel said. I mean, governments are also doing shock responsive social protection at times and delivering assistance in response to crisis. I mean, the Ukraine is an example. Philippines is another. There are so many different countries that have that example, and so I think it actually becomes a bit dangerous to say that the speed of humanitarian actors is risking not saving lives or having people potentially die, whereas the government's actually doing that. So I think the risk is actually bigger. We might actually be duplicating assistance. We might be avoiding or ignoring or neglecting certain populations that are already covered, perhaps. So that's one quick point. And just another quick point that I would make is also on the coordination of cash working groups. There's a very big debate as well about, do you bring governments into cash working groups, which I have seen, for example, work very well in operational contexts, such as Greece, Philippines, a number of different, Lebanon, for example, as well. But also the question is, how do we as humanitarians look at coordination mechanisms of the government as well? And how can we come in and attend those perhaps, or have an interlocutor that is able to then exchange information as well? I'll stop adding to the conversation and just look back at the chat box. There are a couple of really great questions, and one of them is from Omar. How much traditional customary institutions are being worked with in humanitarian assistance? What does the evidence, if any, show about their effect, and what are their main challenges of incorporating them? And then I have another question from Nalia as well, but perhaps I'll leave that to the panel to answer first. Rachel.
I guess if nobody else wants to have a go at this, I can have a try. We have spent a lot of time in the basic team having conversations that sometimes have got to a bit of a dead end on what does traditional and customary mean? what does informal mean? What does unofficial mean? What does community-led social protection mean? To try and get to a point where we're capturing not only things that are done by international agencies and governments in the most formal of ways, but trying to capture all of those things that communities do to support themselves, that civil society does to support communities and individuals, because all of those things help us explain that puzzle that Weri identified before, that the price of vegetable oil hadn't gone up in Mekelle, that markets were still working, and that people were surviving despite then there being a gap of, I think he said, 6 months of getting food aid into Tigray. And so it's definitely the case that we don't pay enough attention to informal, customary relationships that enable people to continue to survive in the most difficult situations. What we're trying to do in BASIC is understand, particularly through some of the work that people are going to do to try and capture people's lived experiences on the ground, both of trying to make a living as a returnee or of people's experiences of trying to access social protection, to try and understand better what it is in local networks, whether they're social or economic networks, that provide other kinds of support that enable people to survive, that enable them to access the assets that they need to try and make a living and so on. And so we're capturing it, but I think I have to honestly say that there's a terminology minefield here where we're left wondering how helpful some of these dichotomies are between formal and informal. So when you take something like a zakat system in some countries, that's a very, very official system. In other countries, it's unofficial. In some places, the rules around it are very formalized. In others, they're not. And we're really struggling with trying not to create these dichotomies in the terminology that we use, but capture the whole range of experiences, the whole landscape of things that people have at their disposal that can be socially protecting. But I think we're a work in progress on that one at the moment.
Thank you, Rachel. Unless anyone else would like to answer that question, I'll just ask, Rachel Sabatis-Wheeler asked an important question as well, that Massimo mentioned the importance of portability of benefits in crises, especially where there are large movements of people. Are there any examples of how this can work, especially if national systems are broken? Can donors support to quickly enable portability? Something interesting for future consideration. Over to you, Massimo.
Yes, and thank you for the question, Rachel, the other Rachel. I don't think we have a lot of example in the countries where often we operate with humanitarian funding, into my knowledge. There are some, and I think there are quite good examples, in particular, I would say in Latin America and in Asia, and I think the Venezuela crisis was another time, another element that made us thinking a lot on how the current government were already providing some of the support. But I would say that from a humanitarian angle, we had, I would say, a limited role in this part. And I think this is probably an area where we could discuss and learn more in the future. Maybe there are other examples. I would say just maybe the last point on this one. I think we learn a lot with the large expansion of social protection in general during the COVID-19. And the pandemic was a major event for us to consider how quick in a different part of the world this system could expand. In terms of portability, I would say it's still limited, the knowledge and information that we received. Over.
Thank you, Massimo. I'll get to Nalia's question as well, which I think is a really poignant one as well. Do you think I think this is to all panelists. Do you think that humanitarian agencies are analyzing the situation in Ukraine with the same standard as in developing countries? Because if we keep looking at developing countries and weak government as justification to establish big cash programs in parallel without having serious efforts, in parallel, working on governance and supporting governments, unions, and civil society to address social protection gap, especially in long-term crises. In MENA, for example, the work on social protection gained much appetite after the COVID crisis hit developed world. Over to anyone who would like to answer that question. And I think it's addressing a little bit that, perhaps potential racism to a certain extent. How do we as humanitarian sectors are coming in and perhaps looking at developing countries and saying, oh, well, you know, in the Ukraine, we're in Europe, perhaps in Greece, we're in Europe, whereas in other countries, we work quite differently. Over to you, Massimo, and then Rachel, or Rachel first. I don't know who put their hands up first, sorry. Unmute yourselves.
Please, Rachel.
Sorry, my hand's not showing us up, but I can come in after Massimo if that's helpful.
Apologies, Rachel.
Okay, just maybe a point. I feel obliged to say something on this particular point. Let me give you a practical example. In Lebanon, until 2019, the main social protection, social assistance program had a targeting of 15,000 Lebanese households. Today, we are in 2022, it's around 65,000, planning to go probably to 100,000 very soon. It means that the expansion of social assistance is happening not only in Ukraine, and is not only because this is Europe. It's a kind of a common understanding from humanitarian and development world that even in any kind of context, an expansion of social assistance is needed. And is happening for the national and for the refugees or IDPs. So my point is, yes, clearly there is a political angle that is very important in each crisis. We should not consider the statistics. I mean, we should consider the statistics and the number that show that there is a large expansion almost everywhere. Over.
Thanks, Massimo. And Rachel, did you say you'd like to come in the end?
If it's helpful, I was chatting with Lottie this week, and she said something to me about this thing that she said already about needing more nuance in what we say we're going to do. And I think one of the things that happens is that there is an assumption of limited capacity in every country, pretty much in Africa, that doesn't actually hold true in many countries. And Lottie was saying that she thinks you sometimes end up with, we're either doing it, i.e. engaging with government in what we in our humanitarian response, or we're not doing. It's just it's all or nothing. And actually there are all sorts of different and more nuanced steps along the way that we could be taking. And it reminds me of something that Nupur Kukreti from UNICEF said at last year's Humanitarian Network and Policy event. In fact, it was the session that you organized, Carla. She said that, you know, we dive straight into countries assuming that there is no capacity to deliver programs, assuming that there's no capacity to scale up and so on. And she was really, really challenging that. And one of the things that we're going to try and do in basic research is look more seriously at capacity and try and unpick that assumption of limited capacity and start asking who has capacity, where, to do what. And we're going to try and understand some of the capacity deficits that people or organizations or institutions might have in three ways. One is looking at the individual, the organizational and the institutional level. One is looking at what Andrew Carden has called the distinction between building capacity, applying capacity, and sustaining capacity, right? Because what we tend to do generally is look at individuals and look at building their capacity, and then don't look at how they're going to apply those capacities in the real world, or how we're going to make sure that they're sustained. And we just end up with this do training for individual people scenario, and we think maybe that's not helpful and we need to look differently. And then we're also going to pick up on a view of capacity as being something which is about competency. So if you were trying to do that task in a laboratory, would you be able to do it? Looking at capacity as also being about capability, which is, can you do it when you get out into the real world? Can you still deliver your job as somebody delivering social protection in a situation where you're having an energy outage every other day, or whether we're in a situation where comms have completely gone down? So that capability is about adjusting to your actual environment. And then, do you perform? You know, and for me, if you look at one of the things that we tend to forget about people delivering social assistance programming is that they are real people living in the real world, and they are just as susceptible to being injured in violent conflicts. They're just as likely to have family or friends who are killed or kidnapped because of conflict. And they maybe are in situations in some countries where they've not been paid for 3 months. So there are all sorts of things that interfere with incentives to perform well. And we're going to try and get to grips with some of those questions. And I think that will help us not be guilty of that assumption that there isn't capacity in Africa in particular, and help us understand the real ways of getting over some of the capacity deficits that we find. Over.
Thank you, Rachel. And I'll give the floor to Werain. Just 1 second, just to mention that we have about 10 minutes left in the Q&A session, and I do see a couple of hands. Fazal, Faluke, I will get to you in just a moment. I'll give the floor back to Werain, and then we'll get to you, and I'll try to address some more questions in the chat, in the box. Thank you so much. Over to you, Werain.
Thanks, Carla. Maybe just to build a bit on what Rachel said, you know, it's very easy for this capacity issue to become a self-fulfilling narrative, or the low capacity issue to become a self-fulfilling narrative. Where there's low capacity systems, you don't work through them, they stay low capacity. Whereas I think the experience in many emergencies is the best moment to build capacity is at the heart of in the middle of an emergency, because they're so profound, they're so clear what these capacity gaps are. And actually, it's very important to recognize that the capacity gaps that rear their heads during an emergency are actually built on development capacity gaps. And so I think addressing them during an emergency actually is very, very fruitful. And I think if there are any WFP colleagues on the line, they can give very good examples of this kind of intentional focus on these capacity gaps during emergencies that have long-term impacts for development of the system. Thanks.
Thank you, Werain. To add, it's also during emergencies where you have the most amount of resources and attention. So this is really where you could also be doing quite a bit more in terms of even co-creating together. And we don't talk enough, I think, about co-creating things together. Understandably, during emergencies, you have to deliver very quickly and everyone is on the spot, but co-creating is also a really important component, I think, of this discussion as well. Fazal, I'll hand over the floor to you if that's all right. And apologies for only getting to now.
Hello, can you hear me now? Hello?
Yeah, please go ahead. Thank you.
All right, thank you so much. So I would just, these were two comments. This is not a question, but I wanted to bring it in front of all of the people who participate in this great discussion. So my first comment is about the relationship between the governments in the global south and the international organizations, particularly in the global north. And so there is a gap between these two entities in terms of trust building, and also it's a history that at government level there are governments who have been doing corruptions, like the international organization when they were supporting them. So they were not achieving what they actually wanted to achieve, basically, and the money would go somewhere else. So there now with the localization agenda, it's really, I think, a good opportunity for international organizations to work through local organizations in the countries. For example, in Nepal, international organizations can't work on themselves. They have to have links with the local organizations in the country. And there is still risk in the way that the governments develop a go and go, which is more government NGOs, and there may be some risk, but I think at the moment, this is one of the opportunities that international organizations can drop in and go ahead with building the capacity of the local organizations and the government to provide support and a kind of sustainable systems for the social protection. The other thing is about the local communities that have their own local systems. For example, in Muslim communities, they have their zakat system and they have sadaqah systems, which I think not very much formalized, and people are not very much aware of those things. And these are also politicized locally, because the people who have the resources, they also want the people who get that money from them. So then they feel themselves obliged to those people who have the resources. So these kind of things, and working on these things and building knowledge and learning and building systems, formal systems in those local communities would be another opportunity. So this is what I wanted to comment. Thank you so much.
Thank you, Fazal. And we can open the floor to anyone who'd like to answer that or address that comment.
Sure, I could say a word on it. Very much agreed that this local capacity is very important to build, and it's almost by definition, and that there's so many opportunities to do so, typically in partnership during operations, that, you know, with some intentional targeted investment, this can be done quite easily. But I think in these conflict situations, it's kind of difficult. There's some special challenges that local organizations face because either history, as Fazal mentioned, or you know, the ways in which they operate, sometimes they fall on one side or the other of particular crisis, and therefore actually cannot deliver as they intend and as they hope in those contexts, and they themselves will withdraw. And so I think we have to understand the context. And in these crisis situations, there's a real need for international organizations to shield these local organizations to the extent that they can even operate in those contexts. But you know, Fazal's big point is couldn't be truer, that there's a real need for that investment in this capacity.
Thank you, Were. Over to you, Massimo, and then we'll try to go to the last question and try to wrap up slowly. Thank you. Massimo, over to you.
Yes, on the risks of corruption of government or dysfunctional system, this is something that unfortunately, where there are humanitarian crises, often is happening. I just would like to mention that just a few days ago, the DG ECO published a new cash policy. And in the chapter 1 of this policy that is entitled Humanitarian Development and Peace Nexus, it's exactly trying to explain how, from a humanitarian perspective, what we recommend to ourselves and to the partners is to work on an analysis. It doesn't mean that it's an obligation then to work in terms of alignment. This should be done based on from the humanitarian side what we call the needs assessment analysis, but we need more and more to understand better how the system is working in that given country. And this is not done systematically in our experience. So more and more often we should have the know-how of the two sides of the house, not only within the EU, but with all the key stakeholders, to understand when is needed and when is not possible to align the humanitarian programming to the current national system. Over.
Thanks, Massimo. I see you, Lottie. Please come in.
Yeah, I mean, just to reiterate that I absolutely agree that the humanitarian community needs to approach working with local systems in a way that is evidence-based and thought through, and those decisions need to be dug into quite deeply. I think that in the same way that we assess needs and capacities of other systems and communities, I think that type of assessment should and can happen alongside, others. And so I think that's right and important and feasible. I also think that does speak to the kind of the nuance that I keep repeating. I think we need more understanding as to who is receiving what where, and I think that's really important to build that understanding in a way that can be kind of absorbed by a bunch of different actors across the whole humanitarian kind of architecture and implementers and donors alike. I also think that in terms of other barriers to localization and in terms of other kind of local organizations, I do think that a lot of the I feel like there's a lot of perceptions about capacity, both of local organizations and also social safety net systems that actually are largely unevidenced. I also think that there are access barriers in terms of funding that the donors will need to tackle and address, to pick up on a point that Paul has made, both in terms of local organizations and in terms of funding going through kind of government systems. So that gets us into a different kettle of fish, but I just wanted to kind of pick up on those points. Thanks.
Thank you so much, Lottie. And I did want to address something Massimo said, but we are running a bit out of time. Foluke, do you think you could come in and be as short and succinct as possible so that we can get to your question? Or Paul, would you like to stop me? Should we wrap up? Are we good? Okay, great. We're just running a minute over on this session, but please come in, Foluke. Thank you.
Thanks very much. I was also thinking maybe to lower my hand because I saw Paul has put in a response. Thanks very much to all of you presenting fantastic work. I'm Nigerian, but I'm based with UNICEF in New York. I was wondering about peace building and how much of peace building we can incorporate into social protection responses, seeing that crises become protracted and long-term, and there might then be fatigue for continuous provision of social protection responses and cash transfers and all of that from donors when crises stretch for so long and peace is not in any near sight. Thank you.
Would anyone like to address that? Make sure to put your hand up. Lottie, is that an old hand?
Sorry, that was an old hand. My internet's awful. I'm so sorry. Was the question about the integration of peace? And thank you so much for the question, Felipe.
Yes, correct. Peace building and social protection responses.
Yeah, I mean, I do think that is a really important point. I think that's something that the humanitarian community is continually grappling with, and especially when the government is party to conflict. And I think that's something that is really, really difficult and is an important point to acknowledge. I don't think it necessarily means there's nothing we can do in terms of supporting systems. It just means that we need to think carefully about risks. I think also where there's conflict, you often see a kind of depleted resources. And so as resources kind of nationally get funneled towards conflict, and so that's definitely a byproduct. And then obviously the kind of operating environment where the humanitarians work kind of and the local actors for the social safety network kind of and the risks to both the staff and the recipients are definitely all issues that we have to tackle. And I think taking them kind of one step at a time and really thinking through the risks as well as the opportunities are really, really important. Thank you for the question. I know we're stuck for time, so I'll just stop. Thanks.
Thank you so much, Lottie. Rach.
Just really quickly, can social assistance contribute to a peace dividend or a state building dividend? The bottom line is it ain't what you do, it's the way that you do it. So having a social assistance program is not enough. You need a social assistance program that's viewed as being fair, that's viewed as that's delivered regularly, and that provides enough support to make a meaningful difference to people's lives. If you're not able to do it in the long term reliably, you will have a negative impact on peace and state building. But if you can do it well, then there is potential for you to have a positive impact on peace and state building. Feluke, thanks for the question. Get in touch, we can tell you more about that. Thanks.
Thanks so much, Rachel. And thanks so much. I actually would like to leave everyone with that really poignant message from Rachel, which is it's not what you do, it's how you do it. I do think that that's something that we need to learn to do better and to have more nuance and improve. With that, I just wanted to say we actually had some backup questions in the case that there were no questions from attendees. So we're really, really happy that you had so many questions and it was so interesting. Apologies for not being able to get to all of them, but I'm afraid that all we have time for today. Thanks again to all the participants for the engagement, for providing us with a rich and lively discussion, and to the panelists, obviously, for shedding light on these really important topics. I'm certain that the conversation will continue to have again very soon. And I will now hand over back to Paul to wrap up and let us know the next steps. Until now, thank you. Over to you.
Thank you, Carla. And yeah, it's been a great discussion. Huge thanks to all the panelists. I was particularly struck by the cooking oil in McKelly puzzle and by the challenge on racism, thinking about how racism influences these discussions and what different actors do and don't do with each other and in relation to each other. So we'll think about how to reflect on that in the work that basic research is taking forward. We've run out of time, so the questions that we didn't answer and the questions that we didn't answer well enough, we'll do our best to write a short blog that reflects on the discussion and tackle some of the questions we didn't get to. Do stay in touch with us, do email us, do follow us on LinkedIn, do get in touch if you think there are things that we should be doing and aren't doing, or things that you'd like to talk to us about how we can think about in our research. One opportunity to stay in touch will be the online discussions in May through the Social Protection in Crisis Context D group. So do join that, do join our LinkedIn page, and so we can stay in touch with you that way. Do fill out the short survey that Alan's posted in the chat. That'll only take you a minute and it'll help us to earn brownie points for FCDO about getting feedback on events and reporting against log frames. So thank you if you do that. And yeah, huge thanks to everyone for coming. This is exactly the sort of lively discussion that we hope to generate, exactly the sort of audience that we hope to reach. And so we're really thankful for you for joining and making it such a useful, I hope, event. And we'll look forward to staying in touch with you. Bye, everyone.
Thank you.
And thank you all.